Okay, hello everyone. Dr. Rich Castellano here. We are here today with Jacqueline. Thank you so much, Jacqueline, for allowing us to teach while we're doing your filler treatment. We're going to be doing some Sculptra for Jacqueline. Jacqueline is a successful executive, and she is an architectural firm, yep. And she wanted to do, we did some Sculptra for her in the past, and it's been about 4 months. And what I really like is if you notice in the top of the brow for her that she's a little more hollow in her before picture, and we were able to get that a little more full in the after, which is gradual, subtle changes. Also, the cheeks, where we get the hollows under the eyes, tops of the cheeks are under the eye. We did a little Sculptra fill there, building the collagen, her own collagen. Sculptra is a great filler, takes up to 2-3 weeks to see some results, can even up to 6 months see continued improvement. So we're 4 months later. Hello, thank you for joining in. So 4 months later, and we're doing a second vial. So we did the first vial, so I'm going to zoom in. Thank you for asking. My birthday was great. It's been, gosh, it seems like forever, but everything and everyone is doing well here now after the hurricane. Of course, that's one of the good things I think about the hurricane is that people certainly have bonded a little bit more. Do we have the Denver dates? No Denver dates just yet, but working on that. And people are, do you find that to be the case, Jacqueline? People talking about people coming together, helping people out. It's not fun or good to have a hurricane come through, but there are good things that come from it, and hopefully Puerto Rico and Dominican Republic are doing well. But today we're here to talk about helping people look younger, look good, feel good, do good. And they said she barely looks 30 years old. And Salam Alaikum, I see some Arabic. Let us know where you're tuning in from. Hello, Kendra Akers, thanks for watching. So I'm going to do a cleanse on the skin. This is for Sculptra treatment. So she's been icing. This is the Hiba cleanse. So I'm going to have you rest your head all the way back. And we do a cleanse on the areas where I'm going to insert the cannula. Okay. And Jacqueline was telling us last time she did it, she had some puffiness in the eye. So what happens is this area, you can get what's called a festoon. And she has some allergy symptoms that she may take some medicines for. So allergies can contribute to that. Smoking, she's not a smoker. And we want to be aware of those things to try and minimize it. But icing will help to reduce festoons. If festoons persist, then you need to do something, consider a laser treatment, something along those lines, or more aggressive allergy treatment. Hello, Linda, and hello, Natalie. Thanks for joining in. So this is a little alcohol cleanse. I like to double up. So we're going to do some in the back of the jawline, brow, temple, similar to what we did before, just gradual layering. And when I showed Jacqueline her before and after pictures, she said, she couldn't tell so much of a difference, but when she looked at the pictures, she could see it, and that's what we talk about. After we do a cosmetic treatment, our vision gets better and our memory gets worse. And it's hard to see those changes when we see ourselves every day. So I'm using the little buzzer for distraction and then a little bit of numbing medicine. Hello, Natalie. Thanks for tuning in. So you'll feel buzz. Pinch on 3. 1, 2, 3, pinch. I'm not in a hurry if you need a break. You doing okay, Jacqueline? Okay. Buzz and pinch. A little bit here in the temple. Brow. 1, 2, 3, pinch. A little tender. Call it our therapeutic acupuncture. It has a way of taking your mind off of everything else in the world. All right. Please do follow us on Facebook. We're on Facebook, Periscope, pinch, 1, 2, 3, pinch. We're also on YouTube, 1, 2, 3, pinch. We were just in Chicago teaching doctors about our 6,000 syringe experience with Bellafill. Thank you for keeping your comments good. Appreciate that. Everything's looking good. So buzz and then pinch. 1, 2, 3, pinch. We are also going to be launching pinch. 1, 2, 3, pinch. Our Practice Profitability MD to teach doctors about how to run their practices and take good care of their patients. So look that up. The launch is going to be this coming week. Pinch. Little pinch. You hanging in there, Jacqueline? Little pinches. Hello, Michelle. Good to see you. Buzz and pinch. 1, 2, 3, pinch. Okay, let's take a little break there. So now that we've done some of the numbing, then I make the little insertion point for the cannula. I'm using a 25 gauge 2-inch cannula. So this is just a 25 gauge. Oh, I have to read that one more time. This is the 25 gauge that I'll use. That's fine. And I find the point where I did the numbing from before. Do you feel a little bit of a pinch here? Not too bad?
Not too bad.
So that just makes the insertion point through the skin, through the dermis and epidermis. We're doing a subcutaneous injection. I like to use cannulas for all of these areas. I think that injecting with the needle around the eye, I don't think it's necessary. I think it's safer to use it with the cannula. Thank you all for tuning in. Thank you for the hearts and thank you for the shares. Hold a little bit of pressure in these areas. We'll get some swelling from the numbing medicine. A lot of people ask us, they say, well, what's the cost of what you're doing here? We have, actually there's a price estimator now on our website. You go to our website and fill that out and get pricing based on what you're looking for. Of course, the most expensive cosmetic procedures are the ones that you have to repeat or that are done overly discounted or someone who's not experienced. Someone said they're on prednisone. Can they still get Botox and filler? The answer is yes, probably, but it depends. So you need a consultation first. Hello, Rhonda. Good to see you. So this is our cannula here, and as you can see, it's a soft tip and less traumatic. So this is Sculptra is poly-L-lactic acid. It's like a sugar molecule. So what I do, once I put the cannula in place, I use the twist technique where I'm stabilizing the tissues with my fingers here, twisting. You feel a little bit of a pinch there, Jacqueline? Mm-hmm. There's a little pinch. Now there's some numbing medicine here. Then I use the shiver technique to just put a little tiny bit of the filler, a little bit here, a little bit there. That's almost 0.1 cc, 1.1 cc, or 1/10 of a cc. So I thread the cannula, twist, twist, thread, little pinch she feels there. Mm-hmm. So then what I'm going to do is I'll put a little bit of numbing. There's lidocaine in the solution mixed with the Sculptra. Pressure pinch, you have some little tender spots. Sorry, and I'm just twisting through to try and navigate through the subcutaneous plane. Sometimes you come across the fibrous tissue bands. Mm-hmm. And I'm really focusing on the area around the orbital rim, top of the cheek, subtle, very fine, very small amounts. Little pinch there. Mm-hmm. Pressure pinch, and you want to do very low injection pressures. Pressure pinch. You feel a little pinch there?
Yeah.
Big pinch, little pinch, medium pinch.
Big.
Big. How about now? Do you feel pinch? Not so much?
Not so much.
Okay. So they'll feel pinches as you advance the cannula, but then that should subside very quickly. So we're building up the cheek, gentle, gentle amounts. You have to mix the Sculptra frequently because it can precipitate. You can have clogging of your cannula if you don't mix it frequently. So there I did just that one area. Hello, Emmeline. Thanks for joining in. So with each injection, it's a subtle change, and she should be able to pass the grocery store test today. If she walks into the grocery, no one does a double take. I like to go from one side to the next to just make sure we keep things as symmetrical as possible. Do you feel a little bit of a pinch here? Little pinch?
Yeah, I felt a bigger pinch
Bigger
there
pinch
than
there.
on the other side.
Over here, a little pinch? Not some, little bit?
Yeah.
Little pinch there.
Yeah.
Okay, so I'm going to put just a tiny bit of numbing medicine in that spot. Feel pinch, 1, 2, 3, pinch. Sorry, a little pinching. Bit of numbing. Everyone's a little bit different. If I have to use a little extra numbing medicine, then I'll do that. It's rare that I'll have a patient that actually needs relaxing medicine before we do a filler. I also tell patients, now you feel a little pressure, a little pinch. I tell patients that they feel a little lightheaded, I'll lay them back in the chair, and it takes just a moment to do. Pressure, pinch, that's uncommon. Feel a little pinch there? Mm-hmm. So now that the cannula is advanced, the tip of the cannula is here. Oh, thank you, Linda. Thanks for watching. Thanks for your comments. Appreciate that. I'm glad you liked your fillers. You doing okay, Jacqueline? Mm-hmm. So the twist technique, twisting, twisting, twist, and then the shiver, shiver, shiver. Everything's looking good. A little pinching through there. Try and go slowly. And then once the cannula is in place, then I do the withdrawal, shiver just to do small amounts. That helps me put very small amounts of pressure on the plunger of the syringe. Very good. That's right. It's always a good reminder to breathe. Everybody should always be reminded to take big deep breaths in and out. Pressure pinch, pressure pinch. Little pinch there.
Mm-hmm.
Now, after I do one syringe, that area is going to be pretty numb. If I come back to do an additional treatment in that area, she'll feel very little because of the numbing medicine that's a part of the cannula. So I like the shiver technique because I really feel it helps you do a small amount of filler in that area. And if you have a tremor, then you just tell people using the shiver technique and they won't know the difference. Now, I'm going to do a small amount in the brow here, but I really like the correction we were able to get with her first session. Yes, and she is smiling. Thank you. Good to see you, Glendale. Jacqueline is a good smiler. She knows the power of smile.
Mm-hmm.
We're all celebrating in Florida the power of smiles, seeing we dodged a bullet with the with Irma. Although one of my patients was from the Keys, and they were not so fortunate there. Now, so then I just thread the cannula through the area where I made the little insertion point. And the insertion point really is pretty tiny, so sometimes I have to search for it a little bit. Got it there. And then once I'm in, then we thread. You feel a little pinch there?
Mm-hmm.
Pressure pinch, pressure pinch. Little pinching there?
Mm-hmm.
Okay, so now I'm just putting a very small amount here. I'm very pleased with what we were able. And then just a little touch in that area. Perfect. Just a little touch more. Jacqueline, how are you feeling, dear?
Good.
Pressure pinch, pressure pinch. Nice and easy does it. Little small amount in that area. Okay, now the rest I'm going to turn your head this way nice and easy. Thank you for following. Thank you for watching. Please like and share. Let others know who are interested in fillers. Fillers are the future of plastic surgery because there's no downtime. You look natural when you're treated with the right expert. Safer. Pressure pinch, pressure pinch. So the cannula is all the way through this area. We get hollows in the temple and even through part of the forehead and the brow region. So now we're just filling that in little by little. For 3 questions when you get fillers. First question is, where do you want them? We like to do full face. Second question, which filler? We have permanent fillers. Sculptra is a long-term filler, 2 to 4 years. We have short-term fillers, 1 year. So decide which filler. And then third question is, how much of that filler do you want? Decide the amount. Now, with each filler treatment, our goals are, number 1, you must look natural. Number 2, safety. Number 3, prevention. And number 4, give you as much improvement as possible. Hello, Chaz. Good to see you. Hello, Lynn. This filler is made up of poly-L-lactic acid. This is Sculptra. We use all of the fillers here. There was a time where I was one of the top Sculptra injectors in the U.S., and now we're one of the top Bellafill injectors in the U.S. It's a long-term permanent filler. Once you do fillers long enough, everybody says, don't you have something that lasts longer? So Sculptra and the Bellafill are more popular now because they are your longest term fillers. Jacqueline, how you doing, dear?
Good.
Everything's looking good. We try and make it easier than the dentist's office. You turn your head this way just a little bit. Perfect. So now I'm going to do some on the other side to the brow. So do you feel a little bit of a pinch here or not so much?
Not so much.
So there, the numbing medicine is doing its job and she doesn't feel it so much. How about here, a little pinch or not really?
Not really.
Little pinch here.
Nope.
Good. Very good. Thank you for tuning in. Someone said it baffles me when 20-year-olds get fillers. You know, if a 20-year-old has little hollows or here and there, I think it's okay to do little bits, but you have to be very conservative for obvious reasons. And so, you know, it is an interesting world we live in today. People are doing all sorts of body modifications. Pressure pinch. You see I'm holding the skin down as I'm gently twisting the cannula here to get position as atraumatically as possible. You cannot do this with a needle. A needle is just far more difficult, I believe. I think this is much safer, much softer than using a needle in this area. Pressure pinch. Feel a little pinch there?
Mm-hmm.
Little, big, medium pinch?
Little.
So we try and keep the pinches as little as possible. Pressure pinch might feel a little bit more there. And the twisting allows you to kind of navigate and negotiate between the fibrous bands or fibrous adhesions that you may come across in the subdermal plane. Everything's looking good. We always have asymmetry. One side is always going to be a little higher, a little fuller than the other. And we want to point that out ahead of time because we're going to have asymmetry before and after. Some patients want to get rid of their asymmetries. It's not practical. And certainly we all want to be perfect, but actually if you make things too perfect, then it starts to look unreal, and that's what will protect you against. Doing okay?
Yeah, my eye though.
You're going to open up your eyes. Open up your eyes.
Just pushing
It's
my
gonna,
eye.
yeah, I'm pushing right in your eye. How does it feel right now?
Feels fine.
It'll feel goofy when you're numb around the eyes. Go ahead and open up your eyes for me. Open up. There you go. How's your vision doing?
It's fine.
Yeah. So you can see, even when we put the filler through there, her vision will be fine. She'll pass the grocery store test. You can close your eyes, whatever you feel most comfortable with. Some patients prefer to close their eyes while we do the treatment.
It feels they feel a little heavy.
They'll feel heavy because I put filler and volume there, plus the numbing medicine makes it feel a little bit heavy. Everything's looking good. You feel a little pressure pinch through here, and I'm holding the skin while I'm using the twist technique to advance that cannula. Gentle, there we go. And then a little bit of numbing medicine there, shiver technique to get the product dispersed. We hollow in the temples over time. We lose bone. And as we lose bone, we get a little bit shorter, and it makes us look older when we lose that volume. So we're just putting things back where they already were. Everything's looking good. Perfect. Pressure pinch. When I do the Sculptra, a little tender there, I like to have patients come back at about 2 to 4 months to do a second session, or they say, well, I like it, let's leave it alone. Filler over implants any day, I agree. Yes, you can do fillers, consultation and fillers on the same day. We do that frequently for our out-of-town patients. Thank you very much. Hi, Chaz. This Sculptra's been around since 2005 or 2006 or longer. Hello, Carolina. Good to see you. And then the Bellafill's been around since 2006, 2007. So a little bit of swelling. I like to do the massage right away. So the shiver technique, the twist technique, and then I like to do massage immediately afterwards. And thank you. Now I'm going to do just a little bit around the smile lines, right in through here. So yeah, Sculptra's been around for a while. Very good. Let me turn your head this way just a little bit. A little pressure pinch through there. That's a little tender area.
Yeah, it is.
All right, so a little bit of numbing medicine, just putting just a touch. We don't want to put too much. And then what I'm going to do is I like to build out, that's a little tender spot, the back of the jawline. So through this little insertion point. Perfect. Okay. Jacqueline, how are you doing, dear? We're beating up on you a little bit. Try and make it as easy as possible. So the cannula is all the way back here, and we're going to thread that through and do a little bit of the Sculptra. I'll use my left hand or right hand depending on the angle and the side. So once we're advanced, then just withdraw a little bit of the shiver technique. That's another 1/10 of a cc. I'll thread it through. Little pinching pinch. Sorry. Okay, a little bit through here, nice and easy. This area is a very safe area. Risk of blood vessel entry or things like that's low. Even with the cannula, it makes it even lower yet. And gentle technique, low injection pressures, constantly moving, all contribute to the safety of the technique. Looking good. The fillers do stay where you put them when you have the right doctor. It's very hard for the fillers to migrate and travel with this type of technique. Hello, Kim. Thank you for tuning in. Good to see you. Okay, yeah, I'm tugging a little bit there. Okay. How are you feeling now, Jacqueline? Okay. Looking good. So we strengthen the side of the jawline because we know the bony prominences, the brow, the cheek, the back of the jaw, the chin, erode as we get older. I'm going to turn your head this way now and turn all the way to the side. Perfect. Can we share with them how young you are?
Yeah, sure.
How young are you? Tell us.
I just turned 50.
She just turned 50. She does not look it, and she does not act her age, and that's the goal.
Definitely not.
Yeah. If you want to look younger than what you can achieve with the cosmetic treatments, then you just have to act immature. So we're very proud of our patients. Hi, Kim. Good to see you. Thanks for tuning in. You feel a little bit of a pinch here or not really?
Not really.
Perfect. So now I'm going to do just a touch. Smile lines, melolabial folds. I find the place where we made the insertion point. I do the gentle twist technique. Feel a little bit of a pinch in this area. That's a little more tender. A little bit of numbing medicine, shiver technique.
Oh,
Give another cannula. Sometimes I will change the cannula. They can block a little bit, so if I just need to change the cannula out, that's simple and easy to do. So I get a fresh cannula here. So once you find, what I'll do is I'll press on the skin and you can see the little entry point where you started, and then you seat the cannula, twist, 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 pressure pinch. You can't get rid of the creases 100% because when we smile, they do deepen a little bit. Okay, make a big smile for me, big smile. See, when we smile, we form the creases, and you can relax now, and that's what always looks the best. Hello, Concrete, thank you for joining in. So then I seat the cannula. Once we're seated, then I thread through, twist, twist, twist. Feel a little pinch there?
Mm-hmm.
Little numbing medicine, a little bit of the Sculptra. Little tender spot. I'm not in a hurry. If you need a break, Jacqueline, you let me know, okay? Big pinch, little pinch, medium pinch there?
Medium.
Medium, okay. We try and keep them small and medium pinches, not too big. Thank you. I'm going to do just a little bit more in the cheeks. If we're lucky, aging keeps coming for us, and we do lose the volume. Yes, thank you so much. Hello, Jody. Thanks for tuning in. So I'm going to do a little bit more in the cheek. I just like to refer to the pictures while we're injecting for reference. And then I will walk around and just look at the patient from different angles. I like to have the patient look straight ahead, and I will tell them, go ahead and open up your eyes, Jacqueline. This is a technique I like. Look straight ahead, and I point. Look straight ahead like you're talking to someone, or you can see yourself there on the camera. And then while they're looking that way, then I look from the front, and I come, and you want to be up front and see from different angles. Go ahead and close your eyes, and then I'm going to turn your head this way a little bit. So I'm going to do just a little touch more here in the cheeks. And now that we've already done some, do you feel a little bit of a pinch here?
Yes.
Little bit?
Little bit.
So she should feel a little, but it should feel a little less than what we did before. It's generally more comfortable once the lidocaine starts setting in from the first syringe injection. So find tiny amounts of the filler. This is the Sculptra. It's in solution. Everything's looking good, and if you go slowly enough, you absolutely guarantee that you will look natural. Perfect. Pressure pinch, pressure pinch. Very good. Jacqueline's doing her yoga breathing, which is good. We all need to do our yoga breathing. That's a good thing to do, whether or not you're having an injection. So just a little touch there. Hello, Helen. Let's see. Someone made a comment about areas getting hollow. We're just filling in the hollows. I'm going to turn your head this way just a little bit. And I like to go back and forth. I may do a little bit here, a little bit there. You want to judge as you go along. Little pinching. And if you're adding small amounts, it's very difficult to get into trouble with the result by just doing a little bit here, a little bit there. Again, the most experienced injector is going to give you a better result. Very good. Twist, 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 holding the tissue still with my fingers. And then the shiver technique. So this is how we like to do full face fillers. Hello Sylvia, thanks for joining in. And I'm going to do just a little bit more. Open your eyes for me one more time. I'm going to do just a tiny, tiny bit more in the cheeks and then we're all done. Okay, I'm going to start back on the other side. We allowed some of the numbing medicine to set in. I like to make sure the patient is resting their head all the way back for their comfort and helps them to hold still, which we certainly like that. You want to avoid a moving target, but Jacqueline's been a great patient. That's the best thing about what we do is the people that we get to work with. And I am very, very proud of our team. We have such a great team. Elise has everything set up perfectly for me, makes it very easy. They take great care of me. I feel very loved, and they take great care of our patients as well. Very good. We're wrapping things up here. Little tiny bit more here, and then we're all done. Do you feel a little pinch there or not so much?
No.
So at this point, she'll feel very, very little. And I'm going to build up some more in what we call the zygomatic arch. So I hold the tissues, I thread the cannula through, so we're right up across the zygomatic arch here. And then as I'm holding that in place, I do the shiver technique, do this last little bit of the filler solution. I'm going to go a little bit lateral here as well. A little pinch, a little closer to the ear. Okay, now we're completely done. So I recommend a 5-minute massage 5 times a day for 5 days. So when you massage, you can't really hurt the product. So I did some around the smile lines through here, some in the back of the jaw, some in the cheek, top of the cheek, or some call it the nasojugal groove or infraorbital region. That's more of an advanced filler technique, and you should only do that if you feel comfortable with that area. I do surgery around the eyes all the time, so it's a very common area that we treat. So let's take a look. So Jacqueline, can you see, why don't you take a look in the mirror? Can you see how it fills in those areas? Okay. A little bit of swelling, but you will be able to pass the grocery store test today. And so, as
Should I use the same amount of pressure that you just used on me to massage?
Massaging, you can pinch,
that was
push.
heavy pressure.
You can do little amounts or large amounts, whatever you feel most comfortable with. You don't have to be traumatic.
Right.
You can push pretty good. The filler is in place. You can't really hurt it, but the massage will help reduce with the swelling, disperse. Does it disperse the product a little bit? It's not going to move it that much, but it's good for the swelling overall.
I did it very gentle last time because I was worried about moving it around.
Not a problem at all. You don't have to worry about that.
Right.
So here are her pictures. Hello, Santos. This was what we did from before first session, where we did around the eyes, around the full face, really. Let me zoom this out just a little bit. See if that will zoom out. There we go. And So now, this was her before pictures, and here is the real thing. So make a big smile for us. So Jacqueline is ready for the grocery store test. You'll be great. Congratulations. Thank you everyone for tuning in, and more to come soon. Thank you for watching. That's all for now. Bye-bye.